Brilliant. Okay, well, we'll kick off, and apologies I can't be in the office with you. As many of you might already know, I've taken up a new role at Lakes in lifestyle medicine, so really looking forward to working with the community down here. And apologies for being a bit late. I was just doing a video call for a gentleman that wanted to use Zyban for helping him stop smoking. So I was going to start off by saying not many people use these medicines, but actually when you've got stop smoking practitioners that talk about them, people do consider using them. So don't think that they're a complete write-off and no one will want to use Zyban. It is a good medicine, as should be considered if people have tried everything else as well. And so I just want to spend this half hour going through and just refreshing your memory on the two antidepressants for cessation. So as I said, there are two. I'm going to spend most time talking about bupropion or Zyban. Remember these, the funny sounding names, the generic names, and Zyban's a trade name. Well, nortriptyline is the generic name and Norpress is the trade name.
Can I just ask you a quick question on this? Why would someone choose to use these medicines rather than the more common NRT medicines?
So someone might use these if they've tried every NRT product. They may also have tried Champix as well. So this is another option when they've tried the both of these antidepressant medicines are a little bit more complex to use because they both have more contraindications. So there are more background medical problems perhaps that you can.
Okay, you're going quiet and loud, so I wonder if you can just get a bit closer to the microphone, see if that helps.
I'll try that.
Okay.
Okay, so we're going to start off with nortriptyline. And this medicine, like most other stop smoking medicines, roughly doubles the chances of long-term. Now, with nortriptyline, I think you'll see when I show you the slides for Zyban, there are relatively few studies. Here we're only looking at 6 randomized controlled trials. So on the grand scheme of things, that's pretty small when we've got over 100 randomized controlled trials for nicotine replacement therapy. But even so, when you look at the long-term quit rates with nortriptyline versus placebo or the dummy drug, you can see that they roughly double the chances of quitting long-term. So that's the evidence for effectiveness of the medicine. It is a prescription medicine, so this is a referral to a GP, typically, who will prescribe the medicine. This one's a little bit difficult to use because you need to gradually increase the dose before you quit. So you can't jump in there and start on 100 milligrams per day. Most doctors will titrate up. So they'll start low at just 25 milligrams a day and work up the dose over 10 to 28 days. So this might be quite good, I suppose, if you've got someone that's not quite in the headspace for setting a quit day just yet, and is happy to sort of spend the first month just making some other behavioural changes to their smoking. But the doctor will be aiming to get up to around 75 to 100 milligrams a day. Why do we go up slowly? Well, this does have some side effects, so we don't want to launch in straight away. Then we use this medicine for 12 weeks, like many of the others, and then generally people reduce the dose slowly at the other end. So you can see it's a little bit more complex to use, but you don't need to worry too much about that because the doctor will prescribe it and this will be all written on the box. So your job when you're working with clients is to go through the instructions on the box to make sure that they understand what's going on. Now, the most common side effects, now this is what we call a tricyclic antidepressant, and these are really common side effects of these medicines. Others you might know of are like amitriptyline, which is used for pain. So common side effects, dry mouth, drowsiness. So you do have to warn people if they're, driving trucks for a living or taxis, just to beware when they first start taking this medicine. Lightheadedness and constipation as well are common side effects.
How severe can these side effects be?
Well, they can be quite bothersome. So people can feel quite drowsy on them, quite constipated. So everyone's different. So you're not going to know, and you don't have to say, well, you'll definitely have really bad constipation, because you might not.
Right. And do they, because they're antidepressants, if you're using them to stop smoking, do they also have an antidepressant effect? I mean, do you feel happy about stopping smoking?
If you don't have depression, then it's not going to make you happier in your life. There are some thoughts that for people with depression, that these antidepressants might be a better option, because they have that effect of antidepressant effects as well.
Okay.
The problem is, of course, with people with depression are usually already on antidepressant medicines, and the problem becomes when you're adding another antidepressant to an antidepressant, which increases the risk of side effects. So that's why we're all a little bit more cautious. And people that are already using antidepressants, that they're usually better off to be using NRT or Champix. But it's not a black and white scenario there.
Okay, there's just a question come in on that chat function relative to what you're talking about. So the question is, can the patient request nortriptyline or Zyban instead of Champix if they haven't tried Champix yet?
Yeah, absolutely. And there are no special criteria for these medicines. So, you don't have to have tried NRT or Champix in the past to use these. Okay. Actually, I can see the chat function now. Let me just... Okay, so then just bupropion, Zyban. So this is another antidepressant medicine. It's an atypical antidepressant, so it's not like, it's in a class of its own, I suppose. And it was found by chance to help people stop smoking. So the story goes that a very astute psychiatrist who was using Zyban, or Wellbutrin as it is in the States, for treating depression, and found that some of her patients who smoked just reduced their smoking or stopped altogether. And that's how interest in this medicine all started. Now, we're not exactly sure on how it helps people stop smoking, but we do know it acts on dopamine and noradrenaline pathways. You know about dopamine pathways for reward, and noradrenaline pathways are often involved in withdrawal symptoms. But what you can say to people is that it works by alleviating or reducing craving and other withdrawal symptoms. And it just makes quitting a bit easier. But it's, of course, no magic cure. Like everything else that we've got, it's definitely a magic cure. In terms of efficacy, here you can see these data are from 44 studies. And you can see that the long-term quit rate in the Zyban arm here is roughly the same as nortriptyline, 20%. Placebo quit rate at 12. So again, not quite a doubling, but a rough doubling in long-term quit rates. Now, don't panic about this slide. I just want to point out a few things that are looking at comparisons. Okay, because people might say to you, is this more effective than NRT, or is this more effective than Champix? So just to point out here, here's Zyban versus nicotine patch. So this is showing you that Zyban is equally as effective as nicotine patch. Here's Zyban versus nicotine gum, again, equally as effective. And here is Zyban versus any other NRT that's been studied, again, equally as effective. However, when you look at Zyban versus combination NRT, okay, that's less effective. So again, combination NRT is more effective than just single product Zyban. Okay.
So a lot of practitioners will want to put people using these particular stop smoking medicines, bupropion and nortriptyline, on the patch as well, or or nicotine gum. What's your thought on that?
So there have been studies that have combined these. There doesn't seem to be any major benefit of combining them, but there's certainly no harm in doing so either. So that's fine, but you can't promise that's going to make an amazing difference there.
Okay, and there's also, I hear from people who have not had a lot of experience in supporting people to quit smoking, that they sometimes believe that these two medicines are just another version of NRT.
Yeah, that's right. They do, and they're not. They work in completely different ways.
And there's no nicotine in these medicines at all.
These are nicotine-free. Yeah, absolutely. Okay. Now, just one more thing, just to point out on this slide here. You can also see a comparison between Champix and Zyban, and this is showing you that Champix is more effective than Zyban.
Okay, sorry, you're getting hard to hear again, Hayden.
So there are 3 studies that show that Champix is more effective than Zyban. Okay, so just to summarize all of that, Zyban is as effective as nicotine replacement therapy and nortriptyline, but it's less effective than combination NRT and less effective. So there's a summary there. Okay. Weight change. One of the perhaps useful things with Zyban is it may be helpful in reducing the weight gain associated with stopping smoking. Actually, this medicine's been used in a new weight loss drug, combined with another medicine at the same time. So for smoking cessation, the studies show that if you take Zyban compared to a placebo, then your weight gain is less, but for only as long as the medication's taken. Unfortunately, once you stop the medicine, weight gain seems to catch up a little bit. But it might be particularly useful for people that are really worried about weight gain. It gives them a little bit of time to focus on changing their other activities in the lifestyle, like nutrition and physical activity. Now, in terms of dosage, now again, you don't have to worry about this because this will be on the prescription, but it's important for you when you're fitting it into your support schedule. So all the tablets are just 150 milligram tablets, and again, you just start this slowly. So it's 1 tablet once a day for the first 3 days, and then you go to 1 tablet twice daily, and you continue that for the whole course of treatment, which is 7 to 12 weeks. Okay, so doctors might vary that a little bit. I usually give a 12-week supply. Now, important to know that you need to keep at least 8 hours between each dose. So I usually say to my patients, so that means if you're taking your first tablet at 8 o'clock in the morning, you can take your next tablet at 4 o'clock in the afternoon, okay, or a little bit later. However, you don't want to take your second tablet of the day just before you go to bed, because one of the side effects of this is insomnia, and so people may complain that they're just not sleeping. And that's a sign for you just to check when they are taking their second dose. And if they're taking it just before bed, move it earlier, but just make sure there's at least 8 hours between each dose. Now, the quit day, this takes some time to kick in, so to speak. So again, you need to take it for at least 1 week before you quit smoking. The instructions will say set a quit day between day 8 and 14. It doesn't matter if it's a little bit later than day 14. As you know, it's important for clients that once they've decided to quit, they're going to do everything they can not to have a single puff. Treatment course I've mentioned, 7 to 12 weeks. The prescriber might lower the dose just to 1 tablet once a day in elderly people or people with kidney or liver impairment. So don't be surprised if that happens. And as I mentioned before, that may cause some drowsiness to start off with. Now, side effects. Don't rely on doctors talking to people about these. Often that doesn't happen. So when you're explaining these medicines, do talk about the common side effects, and they are difficulty sleeping, so insomnia, headache, dry mouth, and I've put rash there focus, and you might see with this, huge. So you might see this from time to time. In the brackets there, I've just put some ideas about if people complain of insomnia, remember just to take the second tablet a little bit earlier, or they could go down to just one tablet once a day. If they've got a headache, it's not clearly related to Zyban, but they can take paracetamol, Panadol, that's fine to use with Zyban. If they've got a dry mouth, sip water. And if they have a rash, of course, your advice is going to be to stop the medicine and send them back to their GP. Ultimately, you'll probably have to switch them to nicotine replacement therapy or Champix. Now, I'm just going to mention this uncommon side effect, but like all antidepressants, all antidepressants have a risk of seizure, but that risk is low. 1 in 1,000 is a low risk in medicine. You don't necessarily need to mention this to them. I do as a prescriber, just so they know, and I talk about the importance of just checking with the prescriber before starting any other medicines. So here's a picture of the rash, and you do sort of get it on the palms of the hands there. You can see it's slightly raised rash. So if you see this and people come to you and say, look, I've started Zyban, it's now 7 days, I don't know, I've got this rash, what should I do? Stop the medicine and get them back to their GP. Now, there are a number of people that cannot use Zyban. Okay, so these are the contraindications. So if you know this, you don't have to make this decision because that's up to the prescriber. But if you know people have epilepsy, if you know that they've had a brain tumor, or you know that they're currently in an alcohol withdrawal program, then they're not going to be able to use Zyban. People with eating disorders, liver disease, liver cirrhosis, bipolar disorder, a particular medication called monoamine oxidase inhibitors. This is a certain type of antidepressant, sometimes used in Parkinson's disease as well. Pregnant or breastfeeding women, and under the age of 18. So this is the no list. Okay, and again, you don't have to go through it all, but if you know, then please don't send your clients to see their GP to say I'd like Zyban, because they're not going to be able to get it. Okay.
So there was a question just come in, and it's around that, about practitioners, stop smoking practitioners sending their clients to GP to get prescription for these two medicines, and the GPs won't prescribe. So would that most likely because they have a contraindication?
Yeah, likely a contraindication, or they might have one of these risk factors. So, for example, I don't routinely prescribe Zyban to people on antidepressants already, because that increases the risk of seizure. There are a number of other, you don't have to worry about these, but just so you know, there's a whole list of drugs that lower seizure threshold. Tramadol, some antibiotics do, the old sedating antihistamines, all make you slightly more prone to seizure. And so when you're adding another drug in there that could increase your seizure risk, then you're increasing the risk overall. So that might be why doctors are a little bit reluctant to prescribe. This is a good medicine for people that are completely fit and well, not on any regular medicines or have any history of seizure. There are a few other things too you need to be cautious of. Anyone with a history of head trauma, anyone who's been knocked out for any length of time, alcohol abuse, because this drug is metabolized by the liver, and low blood sugar, that's hypoglycemia. Now, that's really about people with diabetes, and if they're diet-controlled diabetes, they can take the full dose. If they're controlled using insulin or tablets such as metformin, they're the oral hypoglycemic, the recommendation is that you go down to just one tablet once a day. But if you're poorly controlled and your blood sugars are all over the show, then Zyban's probably not the best medicine to use. Okay. Now, that's all because if your blood sugars drop too low, then again, you're more predisposed to seizure. And finally, use of stimulants or anorectic products, stimulants including methamphetamine here as well. So it's just something to watch out for. I was around when Zyban first came out, and I just wanted to I was reflecting actually on the days where I had clinics where everyone wanted to use Zyban, and it was really fueled by the media. And happens whenever we get a new stop smoking medicine. These from media, from newspapers. And you can see there, the first one, a revolutionary anti-smoking treatment claimed to be twice as effective as nicotine patches is available on the NHS prescription from today. And so everyone wanted to use it. And I think that there's a little bit of inappropriate prescribing going on, because about 18 months later, this is what you saw: Zyban linked deaths double in 2 months. And then everyone was completely off this. Now, it wasn't that there were any deaths. It wasn't that Zyban caused a huge number of deaths. As you know, people who smoke often have other illnesses. But when you're prescribing it in a way which is perhaps not as good as you could be, then there are going to be more problems. So this is just about having a little bit of caution, but don't be overcautious. Don't not talk about it with your patients, because actually they may really benefit from it. So it's about just getting that balance of risks versus benefits right. So this is what I would recommend that you sort of explain to your clients. It's not a magic cure. It is an antidepressant medicine, and so it has some common antidepressant side effects. So headache, dry mouth, difficulty sleeping, some of those, constipation, certainly with nortriptyline. Zyban, of course, you have to start tablets before your quit date. And you start with just 1 tablet once a day for the first 3 days, then go up to 1 tablet twice a day, keeping at least 8 hours between each dose. And also, just for those, especially those that are driving or operating heavy machinery, I get them to start it when they've got a day off, just so they know how it affects them. And your quit date is at least 1 week after starting Zyban. So just to recap, just a few questions. You can answer these yourself. So how is it used? When do you start it? How many tablets to take? Remember, you need to start this at least a week before your quit date. 1 tablet once a day for the first 3 days, then 1 tablet twice a day. Does Zyban reduce weight gain after quitting smoking? Excellent, your answers to that one. A bit slow, but yes, it can. That's one of the advantages of Zyban. How much does it cost? Well, it's just the usual prescription charge, because it's fully subsidized. And you can use it again and again and again. So there's no limits on it like there is for Champix. Is there anyone who can't use it? Yes, remember, anyone with a history of seizures, so people with epilepsy, any history of head trauma, liver or severe liver or kidney disease, eating disorders, people taking drugs like monoamine oxidase inhibitors, or pregnant or breastfeeding women can't use Zyban. Finally, is it more effective than NRT? No, it's not. It's roughly the same, roughly doubling the chances of long-term quitting. And that is all I want to say about those prescription antidepressant medicines.
Okay, so there's one more question come in through the chat function. So what happens if people quit smoking less than 1 week after they start taking Zyban?
If they quit, it may not. If they quit within that week, it may not have its full effect in helping reduce withdrawal symptoms, but it will be kicking in fairly soon. So I would just congratulate them for quitting and help them stay abstinent. So it's no big deal.
And one thing that I hear quite a lot of is people who are wanting to quit smoking, and they may have tried NRT products and didn't like them or couldn't use them for whatever reason. But they're very, very wary of using something that's labelled an antidepressant. They often say, I don't want any more drugs in my system. So how would you approach using these medicines for people who won't or can't use NRT?
So I don't force people to use anything. And I never argue with people. My role is to provide advice. So I'd say, look, is it okay if I just tell you about all of the medicines that we've got on offer so you can make an informed decision about what you want to use? If you've got people that say, I don't want to use it, I don't want to use an antidepressant, I would never try and convince them otherwise.
Okay. Okay, well, I might open up to oral questions, if that's okay. You okay with that, Hayden? I'll just unmute people.
They can unmute themselves.
Oh, you can unmute yourself if you've got a question to ask Hayden. No? Oh, here we go.
Can I ask a question?
Absolutely.
I have a client who's actually been on antidepressants for a while, and he's just come off and doing quite well actually with being off his antidepressants. But then he came up and said he wanted to quit smoking and he wanted to use tablets because he says NRT has never worked for him. So I sent him to the doctor and they've put him back on nortriptyline. Do you think that will be a problem for him?
I don't think that will be a problem for him. I mean, as you see, nortriptyline can help people stop smoking. I give that a go. And if for some reason he doesn't succeed, then he could certainly try varenicline next, Campix next.
Thank you.
Any other questions?
Any other questions? I think that might be us. Hayden.
Well, I hope that was a useful summary. And do give it a go, or do think about it with your clients. There will be some people that everyone's different. Some people respond to these medicines in different ways. So, you never know which ones are going to work best. So make sure you open up that option for everyone.